Good afternoon. Today is Tuesday, May 27th, 2014. We're going to be doing the final video with a complete head-to-toe examination. This is my sister-in-law, Cindy. She's going to help me today. We're going to start with height, weight, and blood pressure. You can take your shoes off and step up, please. And go ahead and stand on the scale. And let's see how short you are. 65 inches. We won't say the weight because that would just be rude. Okay, once you sit down, we're going to do blood pressure on the right and left arms. Okay. Look, there's a ghost.
Guess what? They can't see. There we go. Doesn't hurt my feelings,
Okay, just once. (115 over 74). Normal. Lost the pen already. 115
pocket.
I'm gonna have my extra one in there. (114 over 80). Is that normal?
It is.
Do you have any pain today?
I don't.
Okay, next we're going to do your eyes. I'm going to see how well you see.
Not very. There's your pen.
Found the missing pen. So we're going to use the eye chart that I have up on my wall. There's really no good way to get this. And I'll have you stand right here.
Okay.
Yeah, you're good. Now you usually wear glasses?
Supposed to.
And you're supposed to wear them for distance?
Yes.
The bifocals are correct?
They are.
Do you have your glasses with you today?
No.
Alrighty then. Let's start with this line.
NUTRITRR. Blurs.
Can you cover up one eye, please?
RHSDO.
Perfect. Can you cover up the other eye?
That one's blurred. DXK DBVN.
So with your right eye, you're 20/20. Both eyes, you're 20/20, and your left eye, you're 20/30. So that's that. I'm going to get us set up for the rest of the exam. Okay, this is a continuing of the final head to toe exam. We've done her height, weight, blood pressure, and her vision. We are now going to start with the head to toe assessment, starting with her head.
Do I have anything in it?
She questions whether there's something in there. I'm unable to diagnose that as I do not have a CAT scan or an MRI, but since we're related, I'm going to say I doubt it. Yep, her face is symmetrical. She has no lesions or open areas on the scalp. Smile. Her smile is symmetrical. I'm going to check your temporal artery and your temporal mental. Positive for the temporal artery. Any pain along the jaw at all? Can you open and close? Close. Open. Perfect. Okay, next we're going to do your visual fields. And I forgot the pen light. I knew there was something I was forgetting. I'm going to start with testing your peripheral fields and first, and then we'll check the inside of your eyes. Would you let me know when you see something?
Right there. Right there. Right there. Right there. Right there. Now.
Okay. Open and close your eyes. Eyes are normal. No bumps, lesions, or growths on the eyelid. We're going to check. Can you do me a favor and follow the pen light? I'm going to take a peek in your eye. I'm going to open your eyelid and we'll look at your sclera, your pupil, your iris, your cornea. Don't mind me, I gotta get really close for this
I know.
part. Open your eyes, look right at me. See red, you see the vessels. Still kind of gross. Besides teeth, the eye might be my second least favorite thing. Good. Eyes look normal, your vessels are good, nothing's intertwined back there. You see the disc? Next, I'm going to work on your ears and your nose. Do you have any pain in either your ear or your nose?
I do not.
Ears are symmetrical, equally placed on each eye. Lower lobe is pierced. It's normal. I'm going to take a peek inside your eyes. I mean your ears, because we just did your eyes. There's no fluid behind your ear. Bone membrane is nice and gray. Minimal wax. I usually see a lot of wax because it's kids.
I don't produce a whole lot.
And that ear looks normal as well. Okay. I'm going to have you take one finger, put it in your ear, and push it back and forth. I'm going to whisper a word, and if you repeat it for me.
House. Dog.
Perfect. Let's try the same thing with the other side.
Cat. Boat.
Perfect. Now, this was Brad's favorite part. Let me know. You can hear that? ever feel it?
Out of my right side I can.
Not on the left?
Not on my left. Now I can. Oh yeah. Yep. Not right now.
Okay, now I'm going to do the fun part. I'm going to look up your nose.
Maybe I should have waited to blow it earlier.
No, we're glad you blew it now. The eagle's nice and pink, moist. Everything looks good and normal. I'm going to check for patency of your nostrils. If you could. Any other one? No difficulty breathing?
Nope.
Perfect. Next, we're going to do your mouth. I'm going to put gloves on. You are not to bite me.
I'll try not to. I could be a kid.
That's why I'm saying don't bite me. Hope it doesn't say ah.
Ah.
Stick your tongue out.
Ah.
And test your gag reflex.
Oh, great.
Ready?
Ah.
Positive for gag reflex.
Oh yeah.
She has no tonsils.
Nope.
So we don't have to station nose. The uvula is intact. Stick your tongue out. And that is perfectly fine. Next, we're going to check your neck.
Okay.
Okay. Turn to the right. To the left.
You mean my other left?
Yeah.
Since I did those mixed up.
Backwards.
Yeah.
Perfect. Shrug your shoulders. Now turn this way. Push my hand. Perfect. Perfect. Push forward. Back. And on both shoulders. Perfect. We're going to check for lymph nodes next. No lymph nodes patable. I'm going to check your sinuses, upper and lower sinuses. Any pain?
Nope.
Any pain up in here?
Nope.
Perfect. And we'll check your carotid arteries. No pulsations. This is heavy. 8 seconds. Next, I'm going to check the trachea. I'm going to get a cup of water for you to swallow and sip. Okay, stop. Hold it. Swallow. No difficulty of swallowing. Perfect. All right, for this next part, I'm going to have Cindy, I'm going to pause the video while she takes off her top so I can check her back, her lungs, and her abdomen and feet. Okay, now I'm going to be doing an examination of her back before I move to the abdomen. Her skin is dry, intact, no lesions, nothing abnormal. Spine is aligned in the middle. She's sitting straight without difficulty. Okay. I'm going to place my hands on your lower back. Take a deep breath in. Deep breath out. Perfect. Again, please. And out. Perfect. Okay, say 99.
99.
Again.
99.
Perfect. No difficulties. I'm just going to go down your spine. abnormal sounds. Breath sounds are nice and clear. I'm going to have you turn around. So I'm going to take a look at the chest. It is dry. Her skin's dry and tapped. She has one tattoo over the left breast. Everything else looks normal. I'm going to listen to your breath sounds in the front. Deep breath. Deep breath. Now, I'm going to listen to your apical pulse. Would you mind lifting your left breast? Thank you. Normal rate and rhythm. Everything sounds normal. Okay, we're going to look at your arms, which are dry and intact. No lesions, multiple freckles bilaterally. Endo lymph node. Then check the range of motion of your arms. Could you bring them up? Yes. Down. And push against my hand. Good. This one. All right. Now we're going to test sensation on your whole body. So why don't you tell me if it's dull or sharp?
Okay.
Okay. For this, I'm just using a set of tweezers that have a sharp point and a duller point. Okay, close your eyes.
Sharp. Dull. 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 Do it again. Sharp. 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 Dull. Sharp. Sharp.
Sorry, I'm trying not to
I know.
cause pain when I pull.
Sharp. Sharp.
And do lighter. Did you feel that? You know
Oh,
what you feel?
lighter. Yep. Yep.
No, I'm not trying to.
I know you're not trying to tickle.
All right, with your eyes closed, I'm going to place something in your hand. I just want you to tell me what it is.
Bottle cap.
Very good.
Oops.
And there's
Sorry.
our bottle cap hit the floor. Okay, open your eyes. All righty. You take a moment here for a break. We'll move on.
Then I had Brad Jr.
Okay, so the next thing we're going to do is our abdominal assessment. Sorry, we're talking about our children during our break. So I'm going to take a look at your stomach. You can put your hands on either side. Her stomach is symmetrical with her umbilicus at midline. She has an innie, not an outie. Hope you emptied your bladder.
I did, which is good.
Okay, I'm just going to take a listen to vascular sounds and your bowel sounds. going to palpate your right kidney. Over. Swings over here. Excuse me. Sorry. You muted.
Yes, I did.
Oh, did you? Everything's normal with your abdominal. Any issues with abdominal pain? Normal bowel movements?
As long as I don't have too much dairy.
So, dairy, lactose intolerance. Alright, next we're going to do lower extremities. I'm going to check your pulses from femoral down to your toes.
Okay.
We're going to make sure everything is in working order. For legs, are dry intact, shaved, but you can tell hair is equally distributed. Everything's symmetrical. Toes are good. Some dry skin. No visible lesions on her toes. So I'm just going to feel for your femoral pulses. Once again, sorry. So my sister-in-law was a nursing student, now a teacher, so she's done this before. And is a very willing and patient person.
So mainly I can, that's all.
Alright, so next thing I'm going to have you do, check range of motion of your hip. I'm going to have you bring your foot straight up and down. Good, straight up and down. Next I'm going to have you bend at the knee and bring your knee to your chest on either side. Perfect. Perfect. Next I'm going to have you bring your feet back, forward, and rotate them. Perfect. Wiggle those toes. Perfect. I'm going to have you sit up and we're going to test some reflexes. Okay, these are usually what people find to be the most fun. These is the reflex hammer. So we're going to start with your elbow. Mild reflex, not too bad. Now we're going to do no kicking. Now these are the ones I always have issues with. Positive reaction, yay. On both.
I can kick you if you'd like.
No, no kicking. The Achilles. And then this was my favorite to do on an infant. We should have a plantar reflex because she's an adult. There we go. The Babinski was my favorite when we did infants. And that's a positive.
Yeah.
All right, so we only have a few sections left. I'm just going to have you stand up, and they're going to be mobility tasks for gait, okay? All right, so first I'll have you walk that way. Perfect. Then when you come back, I'm going to have you do heel to toe. Perfect. Tippy toes. Pretty ballerina.
Gotta make it
Now-
fun.
Now coming back on your heels, please. Perfect. Can you bend over and reach your toes?
I can't.
Perfect. Now we're just going to check the spine. Can you lean all the way back? Okay.
Oh, back.
Perfect.
My other back, right?
Forward again. Perfect. Now I'm going to have you do one last thing. I'm going to have you stand still and close your eyes and see how you maintain your balance. I may even catch you.
Only if you feel like it.
All right, you're all set.
Okay.
Thank you very much for being my participant for multiple tests this semester. It's greatly appreciated, sister.
Not a problem.
And that concludes